We do have also a wireless alarm, very new addition to the range. This one will fit, is a magnetically fits on the outside of the on the waistline of the underpants and attached to the outside of the underpants. And then when it's triggered, the receiver, which is away from the bed, will go off, and the child has to get up and switch it off. So we do have quite a large selection of different alarms, so that hopefully the child will select the one they like. Also, for some reason, some people do prefer to have the bed mat version. So we do have the bed mat and a bedside alarm. This one has got the ability to record a message or a phrase, if you like. We have volume control, as well as having the different sounds, or you could select individual sound. So this is quite flexible. You can also attach a vibrating unit to put under the pillow if you wish, or even you could have an extension to the parents' bedroom again if you wish. The major disadvantage or main disadvantage of using a bed mat is the fact that the bed is going to get wet anyhow. So mum has to change the sheets, and the danger is if she doesn't change the sheets during the night, the child will wake up, go back to sleep into another dry bed, and the chances are mum will have two wet beds in the morning, which is not very encouraging to use the alarm. So they stop using the alarm. So as long as the parents or the mum is happy to use is aware of the problem, if you like, of having to make the sheets, make the bed and change the sheets, then that's fine. You could, but I think it's a point which needs to be emphasized as well. This is mainly the alarms for use for nighttime wetting, for bedwetting. Some children at school basically too busy playing, and they forget to use the toilet during break times and end up wetting themselves while they're in the classroom. So for that problem, we have a Vibro-Watch, vibrating watch, which you could program to specific times to coincide with break times, lunch times, and you could program it up to 12 different times. So the child, it's a normal watch in every sense of the word, it just have a vibration rather than sound, so the child is discreetly reminded to go and use the toilet, so when it vibrates. And that seems to be the most sensible solution for daytime wetting, and we do have different colors, as again, to suit children's taste. So the golden rules are motivation. It is important for the child to be wanting to be dry. Obviously, nobody wants to wake up in a wet bed, but if the child is not bothered, then you need to find out if there is any other problem, maybe unhappy at school, or there's some problem. You need to solve that problem first. So the child needs to be motivated. You cannot help somebody who doesn't want to be dry. It is also important to explain that waking up to the alarm is a treatment. So ignoring the alarm, putting it away, not using it, is not the fault of the alarm. It is important for the child to wake up to the alarm. It's vital for parents to help the child wake up when they hear the alarm as well. So it's no good mum coming back and saying, well, everybody woke up and the neighbors, but not the child. It is vital for the parents to help the child wake up properly so they remember the event in the morning for the first few nights until the child starts to wake up by themselves. Very important for the child to drink as much as they like, no restriction of fluids, obviously water, juice, milk and so on, but they can drink as much as they like. No lifting, so parents shouldn't, or mom shouldn't take the child while they're asleep to the toilet and empty the bladder before she goes to bed. No pull-ups or nappies, because again you're confusing the child, you're giving them the safety net but expecting them to wake up. And just support and encouragement, and it's guaranteed to cure a child from bedwetting. Thank you.